Good morning, dear students. So now today we are going to discuss axilla. So axilla is nothing but the armpit region. So this is the dissection what you will be doing after finishing the pectoral region, which you have done as the previous class. So once you dissect the skin from this area, so you will be able to see many structures we will be exploring that we will be studying under axilla. So like we will be seeing the muscles which we have cut in the previous class. You have seen pectoralis major, minor, subclavius, right? As the anterior aspect of this. Suppose this is the armpit, the space what you have, the pyramidal space. Behind you will have various other muscles like subscapularis. Okay, we will see the details. Now, of course, as contents, once you clear all these structures, you will be able to see the axillary artery. Yellow ones are cords of brachial plexus and their branches, and we also see the axillary vein. Okay, so now the objectives of today's lecture are you should be able to demonstrate, like describe the boundaries and also contents of axilla. I'll try my best to make you understand. Now, axilla is nothing but it's a pyramidal space inferior to the shoulder, and it is seen at the junction of arm and thorax. So this is the armpit. So it is generally considered as distribution center for the neuro, which is shown in yellow color. Vascular is red and blue, that is blood vessels that serve the upper limb. So it is protected by the adducted upper limb. Now see, dissection of the pectoral region you have seen in the previous class, where you have given one midline incision extending from the suprasternal notch to the xiphoid process. It's only a revision. You have given one incision from the suprasternal notch to the almost acromion process, and the lower one also you have given almost up to the middle part of the like lower end of the thoracic region. And then once you reflect the skin, and here in the arm you have seen like the incision was given almost up to the deltoid tuberosity, isn't it, that line? So once you reflect the skin, see, we will be able to see inside the brachial plexus, axillary artery, and also the axillary vein. Now, this axilla, which is nothing but the armpit, it's a pyramidal space situated between the upper part of arm and the chest wall. So it has certain boundaries, like it has apex, it has base. Different colors have been used for your clear understanding. It has anterior wall, okay, then which has actually been opened to show the things. Then once you open the anterior wall, you will see the posterior wall. This is the medial wall, the other side is the lateral wall. Okay, so we will discuss all the boundaries in detail. Just it's an overview, like so many boundaries we have. Okay, apex, base, then anterior wall, behind which we will have posterior wall. Near to midline is medial wall. Away from midline is lateral wall, and it is disposed. Axilla is disposed not in straight line but obliquely. Now coming to apex first. Now the apex is like, see, this area where I am keeping my pointer now is apex region. So it is truncated and it is bounded anteriorly by this bone. What is this bone we have? This is the clavicle. The posterior surface of the clavicle is one boundary. Posteriorly, you are finding the superior border of scapula, and medially you are finding it is the outer border of the first rib which forms the apex. So this particular area is nothing but apex, posterior surface of the clavicle, and then superior border of the scapula and medial aspect of the outer border of the first rib. Okay. Of course, the posteriorly not only you will see the superior border of scapula, but we also see the medial aspect of coracoid process. So once you know the apex, now we will try to see the base or floor. Base in the sense when you have just abducted the arm, when you are planning, when you have prepared yourself for doing dissection. So you will see skin and lot of hair in the armpit region. That is nothing but the base or floor. Once you cut the skin, you will see the superficial fascia where lot of fat will be there. Abundant fat you will see in the axilla region. Okay, into which you will see pea-sized structures. I told you previously also, those are nothing but lymph nodes. Okay, and we also see the axillary fascia enclosing the axillary vessels and the cords of brachial plexus. Now, see, this is again nothing but base. Like I told you, lot of fat into which pea-sized structures. These are axillary group of lymph nodes. Okay, the whole upper limb has been cut in, like to give an orientation to know like how this looks. So this is the anterior end of the picture. This is the posterior end of the picture you are finding, isn't it? This is the scapula muscle. Let us try to understand this picture. Scapula muscle. So whatever armpit, lot of fat only you are seeing. So that means all structures are embedded in fat. So what are the various structures we see? We find axillary artery, we find axillary vein, we find surrounding is like cords of brachial plexus. Brachial plexus you will have like in next 2 days, like we have lateral cord, medial cord, and the posterior cords of brachial plexus surrounding this axillary artery and vein. Then these whitish structures which are shown here lower down, these are the axillary group of lymph nodes. Now, if you try to understand this picture, immediately below the skin, in the pectoral region, what is the first muscle we saw? Pectoralis major, below, behind which we found pectoralis minor, and in the same plane we found the subclavius. So there was one fascia called as clavipectoral fascia, which was splitting to enclose the subclavius and pectoralis minor, isn't it? So that means if you consider this as armpit, so this area becomes the anterior boundary, okay, which is bounded by pectoralis major, subclavius, clavipectoral fascia, and the pectoralis minor. Then behind, if you observe scapula bone, and we have costal surface and then we have dorsal surface. In the costal surface, we have subscapularis muscle. So you can consider this as our posterior boundary, and lot of fat with axillary artery, vein, lymph nodes and the cords of brachial plexus will form the contents of axilla. Okay, then I'm just trying to show you like boundaries one by one. Let us see the anterior boundary first. So the anterior wall, this is the pectoral region which we have studied in the previous class. Okay, so this is the pectoralis major muscle which is cut now in order to show the next muscle, that is pectoralis minor, and this whitish fascia whatever we are finding is the clavipectoral fascia. Below the clavicle here you also have the, what is this muscle we have just below? That is subclavius. Okay, so this is subclavius. Cut muscle is pectoralis major, and the small muscle we have is pectoralis minor. This is clavipectoral fascia which is pierced by certain structures, isn't it? Cephalic vein, thoracoacromial artery, and lateral pectoral nerve. You should know these structures which are pierced by the clavipectoral fascia. They all take part in the formation of the anterior wall. Okay, so in this anterior wall, like these are the structures. Now coming to the posterior wall, posterior is axilla which you see from behind. So that means what muscle we see from behind? So this is the costal surface of the scapula where you are finding subscapularis. Now if you see more from behind, we have the teres major muscle. Okay, and this big muscle what we have discussed in our previous class is latissimus dorsi when we were doing back muscles. Now coming to this medial wall, so medial wall is formed by upper four ribs. In between the ribs we will have intercostal muscles. Apart from that, so this muscle, boxer's muscle you have, that is the serratus anterior muscle. Okay, so that is the medial wall. So if this is the armpit, so this is the armpit you have, so this is you have is serratus anterior. Okay, then this is the anterior wall and this is the posterior wall, this is the medial wall, and lateral wall is actually converging over here. Okay, that is the humerus bone. Now, the medial wall, already I told you, like it is formed by the first four ribs. I just put this picture so as to show you the intercostal muscles. Okay, over which you are finding the serratus anterior muscle, over which, of course, you are finding the long thoracic nerve, And you are finding in the second intercostal space there is one nerve piercing that is called as intercostobrachial nerve, which is seen as the content of the medial wall, which is nothing but lateral cutaneous branch of second intercostal nerve, that is T2. Just simply remember that this is the second thoracic nerve, that is intercostobrachial nerve. Now coming to the lateral wall, so lateral wall is formed, I told you by, if you observe this picture, I told you, like in this picture, this is the anterior wall and this is the posterior wall and this is the medial wall. So lateral wall is actually formed by the, this is anterior, convergence of anterior and posterior. So this point is actually humerus. Okay, so lateral wall is formed by the upper part of the shaft of the humerus, okay, where we have the insertions of coracobrachialis and short head of biceps brachii muscles. Okay, then, so these are the various walls you are finding. So this is apex and this whole thing is a pyramidal space what you have, isn't it? So this is apex, this is base, medial wall, lateral wall, anterior wall. Once you cut the anterior wall behind you will see posterior wall. So that is, it is a pyramidal shaped box. Okay. Now suppose this axillary artery is the content. So this is our anterior wall formed by pectoralis major covered by pectoral fascia. Behind we have subclavius and pectoralis minor enclosed by clavipectoral fascia. Posterior wall of the axilla is formed by subscapularis teres major and latissimus dorsi. Contents are axillary artery, axillary vein and cords of brachial plexus. Okay, this is again seen from behind which forms the posterior wall. Okay, now so the contents of actually neck region, head and neck region, they are passing through the apex of the axilla and then entering into the axillary area, into the axilla. From the apex they enter into the axilla and then they will be exiting through the base area and then entering into the arm region. That's what I want you to understand. So that means whatever facial coverings are there in the neck region, they are being prolonged and they are carried into the armpit. Okay, so they form a sheath which is called as axillary sheath, which is actually derived from the prevertebral fascia, which you are going to study when we do head and neck region as a part of gross anatomy. Okay, so axillary sheath is derived from the anterior middle scalene muscle fascia. That means prevertebrate. Right in front of the vertebrae, we have scalene muscles. The fascia covering the scalene is the prevertebral fascia. It comes from the neck region to enter into the axilla region, covering the axillary artery, axillary vein, and also brachial plexus and nerves derived from it. Okay, so once you do dissection, when you come to the dissection hall, when we start doing dissection, you will be appreciating more. Now once you have seen all the boundaries, now let us see what are the various contents we have seen in the axilla. So we have seen this as axillary artery, and of course now following the axilla lecture we are going to discuss axillary artery in detail. So we will be seeing the branches, we will see the axillary vein. Always you have to take the vein in reverse direction because it is the venous drainage. The axillary vein will drain into subclavian, subclavian vein will drain into, finally the brachiocephalic will be formed which will be draining into superior vena cava. Okay, so whatever, see the clavicle bone has been cut. So from there you are finding the infraclavicular part of the brachial plexus. Okay, basically there will be most of the cords and branches coming from the cords of brachial plexus. Okay, and of course we will also see pea-sized small round nodules when we dissect lot of fat inside. So we have 5 groups of axillary group of lymph nodes and associated lymphatics. This also we will discuss today, axillary group of lymph nodes in detail. So apart from that, we also see the long thoracic nerve. Okay, on the medial wall I have shown you. And intercostobrachial nerve I asked you to remember as T2. This is long thoracic nerve, okay, running over the serratus anterior. Then you also have piercing the thoracic cage, entering into the upper arm, you will see the intercostobrachial nerve. and lot of fat will be there, areola tissue will be there, in which all these contents are embedded. So these are the contents of axilla. So now overall certain facts I want you to remember, like sternocneurotic part of pectoralis major is twisting around itself, the coastal fibers of the same muscle. Then latissimus dorsi twists around the teres major. Thus, actually, the smooth anterior and posterior walls of axilla are formed. Okay. Apex of the axilla is cervicoaxillary canal, because the contents of neck region are entering into the axilla, giving passage to axillary vessels, and lower part nothing but infraclavicular part of brachial plexus. So axillary sheath is derived from prevertebral fascia. So this will be followed by the axillary artery lecture. First of all, try to understand this lecture thoroughly. You should know the boundaries of axilla, contents of axilla. Then you will be able to understand axillary artery and axillary group of lymph nodes. So today itself, those other two lectures also will be uploaded, and then this will be followed by brachial plexus. Okay, thank you.